107 FM, the voice of women, Nigeria's first and only radio station for women and their families. Today is Friday, the 8th of May, 2026. Thank God it's Friday. Right about now, the time is 3 minutes after 10, and it just finished raining torrents of rain. It was doing boo boo. I'm hoping that maybe this is the start of cool weather. I'm hoping so because the sun has been unforgiving. I don't know who offended the son, but if you're the one that did, please just go and ask for mercy because it's been crazy. But hopefully, we start experiencing some coolness, and the sun will just not be doing us anyhow. Basha, 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 sha, sha, sha. This is Radio Doctor, your free health consultation program where real doctors advise real people. And it is Nigeria's first specialized health program where medical doctors consult for free and advise for free on women radio. It's broadcast 10 a.m. on Mondays through Fridays. My name is Fumi Bangala, and our doctor today, you already know today's Friday, so we have our Americana doctor who is here with us today, Dr. Abiola Jai, the MD CEO of ROA Specialist Hospital. So what's this Friday? You're going to hear 000, so yes. Hi, Dr. Abiola, how are you?
I'm doing well. 1 second.
Okay. Right, we are live on YouTube at WFM 917, and you can listen to us on the go via our website, www.wfm917.com. I would say let me call out the numbers to call or text, because you people will not text me, but you will go to Dr. Abiola's office to go and be collecting freebies. I know you, I know your names. Don't let me start mentioning your names. But the numbers to call, should you wish to do so, is 7,917-917 or 0800-1235 917, and then you can text, WhatsApp, or send your voice notes to 08155 917 917 or 0703 1756 537. Dr. Abiola, are you with us now? No, not yet. Hi, Dr. Abiola, can you hear us?
Now we're good. Yes,
okay,
very
awesome.
good.
And how are you?
I'm doing great. And you?
I'm good. I'm shining, so I'm good. I'm good. Today we're going to be talking about annual female checkup. Every woman should stop postponing. If I didn't know Aisha any better, I would say that Aisha's my producer. I would say that Aisha picks topics where Dr. Abiola can drag us to filth, but I know her, and she's not doing it intentionally. But yes, let's get into it this morning. Dr. Abiola, why is it important for women to prioritize annual medical checkups even when they feel healthy?
So, it's because when we talk about this with different topics, but
yes,
many serious illnesses in women do not start with pain. Everybody, I get that a lot with patients. They'll say, "Well, but I'm not feeling any pain." When I give somebody a prostate cancer diagnosis, or I'm not feeling any pain. So, a woman may feel healthy and still have high blood pressure. She could have early diabetes.
Right.
She could have high cholesterol, kidney problems, thyroid problems, even, infections, sexually transmitted infections, all these, or even an early breast lump, so symptoms are often late warnings. It's often when things have gone too far or very far. So annual checkup is not just looking for trouble, it's preventing trouble. And we believe that here in this environment a lot, is that why would I be looking for trouble? So a checkup is like, I'm looking for trouble. Meanwhile, if you look at it from our point of view, you're trying to prevent trouble down the road.
I like that you say that, because that's also like something that I say. I'm not gonna lie. One of the major reason I'm not going to lie that I haven't come to ROA at all is because I'm just like, God, I beg. No, like, that's the major reason. And I feel fine. Like you just said, I feel fine. I feel healthy. There are moments where I'm like, there's something wrong with me. But I'm like, over time, I'm like, I try to figure out, okay, what is it? Or I do like my my what they call it, my what's the word? It skips me now. The my
Bread.
no 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 no. As in, like, if there's something going on with me, so for instance, what I mean is, if I see that I'm adding a little bit of weight and maybe I have a party to go to, and I'm my clothes are on my tailor, I'm like, for me to look really, really snatched, I need to lose like maybe 1 kg. So I stop eating bread, though I plan to eat bread this today because it's raining and I'm going to eat it with tea. Sue me. So I do that. So I have my quick fixes. That's what I was gonna say. I have my quick fixes whenever these moments happen, but I'm going to try. I'm going to try to come and do my checkups because even the HMO I
Be an
have.
inspiration. Be an inspiration for the
Uh,
listeners.
hey,
You know.
God, I beg. God, actually, I beg. Okay, let's keep it moving. What are the basic screenings, health screenings, every woman should do at least once a year?
A basic annual checkup. You'll have your blood pressure. You should
Okay.
do your weight and your height, and with that, it can calculate body mass index.
Hmm.
But sometimes we do waist circumference. Just your waist measurement through your belly button.
Okay.
Blood sugar, very important. Blood sugar, cholesterol, or what we call a lipid profile. And then we'll look at your kidney function and possibly liver function and your blood level, something called a PCV. That's to rule out anemia. And one of the most important is the doctor's consultation, because in that consultation, a competent doctor is going to be asking you about family history, your personal history, and they may add or subtract some tests based on that.
Mm, okay. The only one out of all the ones you mentioned I know is my weight. I'm obsessed with my weight. When I mean obsessed, obsessed. And there was a time that I stopped taking my weight, but now I'm obsessed. When I say I'm like, oh, girl, you gotta you have to do better. But these
I'm,
days I don't know
I'm
what's
I'm
going
not,
on with.
I'm 90 kg.
I'm always saying, man.
So yeah, let's
I'm
all
not.
let's all declare 6'2.5", 6'2.5" 90 kg. So I'm not doing
No,
too badly.
no, I'm okay. I'm okay.
No.
I the day I come to ROA, that's when you know my weight. Me, I still
No problem.
never. How? Like the last time I went to the hospital, I took my kid there, and I got on the weight, and I said, "What is this?" I was like, "Oh, I've eaten today. Oh, that is why." But okay, let's keep it moving. What are the basic? I've asked that question. At what age, should women begin routine health screenings like pap smears, breast examinations, and so on and so forth?
Every doctor has different numbers and their different guidelines. I use what makes sense, which is from age 20, let's say you really want a woman especially to know what normal breasts feel like. So from age 21, you should have developed your normal breast. You want to know the normal breast because then if you feel a small lump or something, you'll know the difference. So, but standard is every from 21 to age 50, you're going to be doing pap smears. And so let's say age 21 to age 40, be doing pap smears and
Okay.
those regular exams every 3 years. And then depending on your results, you may do it more frequently from age 40 on up.
Okay. 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 Awesome.
So it's not, the point is that you're not waiting until you're 65 to do screening.
Right.
You're not waiting until you're retired. You want to do this in your healthy adult so you can catch things early and also
Yeah.
know your baselines for most things.
Yeah. Okay. All right. So for a lot of women like myself who postpone checkups due to fear or due to busy schedules, what are the dangers to delaying or of delaying these appointments?
Did you mention fear? Did you talk about fear too?
Mhm. Mhm. Mhm.
The mostly I don't know how to put it, but what's disturbing is that delay allows those silent diseases or those diseases where you may not be feeling symptoms. It allows them to
Mhm.
become advanced disease.
Mhm.
So I can't tell you how many times I've taken out a very small breast lump and it ends
Mhm.
up being cancerous. Meanwhile, we got everything, so you've basically cured that breast cancer. But imagine if we didn't catch it on time, or she didn't bring it to our attention on time, and it's now spread to the bone. You can't go and now just remove it. That patient has maybe, you now start counting their lifetime in years. Like, you have 5 year survival rate and
Mm-hmm.
things like that. It's not good. Kidney failure doesn't just happen all of a sudden. It's a progressive kind of thing. So if you
Right.
can catch these things early, you can try and reverse them. And trying to reverse them would not be as hard as when you catch them late.
Right.
So it's not whether you have time for a checkup. To be honest, it's whether can you afford the consequences of not being checked. Because if you
Mm-hmm.
come down with something, or have a blood sugar or high blood pressure crisis, you have a stroke, or you know, can you afford that, or the consequences of that? Missing 2 weeks, being in the hospital, possibly losing function, or do you have time for an annual checkup? You tell
Mm.
me.
I have them. I have them. Interestingly, interestingly, yesterday I was saying to, on the show yesterday, Radio Doctor yesterday, Doctor we came on the show. Who came on the show was is a dentist, and he was talking about how often you should get, your teeth checked, and he said, oh, at the very most twice a year, and I was like, ooh, because the last time I did, and this was not that I did because, oh, let me just go and check my teeth. It was that I wasn't having pain. It felt like my tooth, his tooth, the single one, was one of it was broken, and I couldn't figure it out. It felt like I kept on seeing pieces of my. I was like, oh my gosh, I'm about to lose my tooth. Please, oh. So I went to the dentist, and it was a case of plaque. Plaque had accumulated, so the plaque had broken off. Since I did not give myself a
Oh,
break
okay.
to go to the dentist to get it sorted out, it started breaking off by itself. So it wasn't actually my teeth that was breaking. And when he said it yesterday that, oh, it is twice a year, I said, I need to go and do doctor's appointment. And I was like,
Every
oh,
6 months. See, we
every
include
six.
that in our annual checkup, or our comprehensive checkup. We include the teeth, taking all the plaque and everything off. So at least that's one.
Oh, you guys include,
Hmm.
but
Yeah,
you have
it's part
a
of it. We have an
uh,
eye center, so you do your eye checkup and glasses, or if you
huh.
need to do
And
dental.
I'm actually due for my eye checkup because my current prescription, I've been using it for years. The last time I went to the opticians, they had told me I needed to change my prescription. I said,
Hmm.
I beg, I don't have money to change it. I just came to check that my eyes were still okay because I took someone there. Then my eyes started hurting, and they were like, well, you're going to have to change it. That was by this year after I turned 40. And I've not gone. And I can tell you for free that my current prescription, some days my eyes are turning on their own. Some days I have to take
Oh
them off
no.
me, and I've not gone. You see that I don't like myself. That's just what it is. Because if I like myself, I will not be having this anyway. This is not about
Yes,
me.
what was your birthday present to yourself for turning 40? Well, it should be a checkup. But what did you get yourself? Let's see.
Nothing. Oh, I
No?
had a party. I had a party. I had a party. But was that it?
Okay.
Oh yeah, it's okay. This is not about me. I'm not the patient here. We're speaking to women who are listening to us
To the
this
listeners, to the
morning.
listeners.
Yeah, I'm going to stop sharing about myself. Doctor, what jazz are you using today? Okay. Let's keep it going. What are the silent health conditions in women that can be detected early through routine checkups?
If I'm being honest, it took me a while until I started doing my checkups
Okay.
too, because doctors don't like to,
Yeah.
you treating other people. You're not thinking about ever treating yourself. Doctors are not supposed to even get sick.
Mm-hmm.
So yeah, it took me a while, probably when I turned 40. So I'm with you, but now it's very important. It's important, I understand, but let's do better. So you talked about silent conditions. We always, our favorite one is high blood pressure. You
Yeah.
know, Hypertension is the silent killer. We also have diabetes, high cholesterol. When you say silent killer, it just means that the symptoms don't just happen. It doesn't just happen overnight. These are things that can build up over time.
Mm-hmm.
anything, thyroid, liver, fibroid. You can have an ovarian cyst, and the ovarian cyst ruptures, and you're now being rushed for emergency surgery. So many of these conditions can become are dangerous when they're undiscovered.
Mm.
But all of these can be detected through your routine checkup.
Mm. Okay. All right. Um, so you mentioned the you have to know your weight, your height. What was the third one? Your waist circumference, weight, height. I don't recall the fourth one you mentioned,
Body
but
mass index, so weight, height,
calculated
is enough.
BMIs. Yes.
Mhm.
So how often, so for things like blood pressure, things like blood sugar, things like cholesterol levels, how often should women check those things?
So to make it simple, regular women, well, at least once a year. If it's normal, okay, next year you check again. That's
Okay.
if you don't have any other conditions. If you're pregnant, you should be checking every office visit at least every 4 weeks,
Yeah. Yeah.
and it may be daily if you now have something like called PIA, pregnancy hypertension, or preeclampsia. So same thing for blood sugar, should be checked yearly. If we ever find if it's normal, check it again next year. If you now find out that you're diabetic, then you should check it daily, or and once you're stable, at least weekly. But it really just depends on what's there, but minimum at least once a year. And cholesterol, I would say about the same, one to two, every year to two. You should be
Yeah, but
checking your
can't
cholesterol.
something change it? Like if I did this checkups maybe now in May, and you're saying
Mhm.
once a year, so that means the next time I'm checking it is next year May. Can anything
Mhm.
happen between now and next year May?
A lot can, that's very true. A lot can, and if you have symptoms in between your checkup, don't just because I have some people say, "Oh, but I did that test in December and it
Mhm.
was normal." Yeah, things can change. So if you feel your body change, head to your doctor. But
Mhm.
usually the things we're talking about are slow change. So usually somebody doesn't go from 110 over 70 to 210 over 130 in a year or even in a day. Usually you'll have degrees of high blood pressure. Your blood sugar won't go from 70 to 200 on average in a day. It can creep up slowly. So here we found that here checking it at least annually is okay for normal. Once you're abnormal, then it's more frequent.
Okay. All right. So we've talked about cervical cancer on this program before, but
Mhm.
how does early detection help in preventing things like cervical cancer and breast cancer? Actually, before you answer that question, I watched somebody's a piece of content online where this lady was talking about the PrEP medication that is it to prevent HIV. I mean, that reduces the viral load. I'm not even sure which one it is. No, not prevent HIV, reduces the viral load, or sort of like some form of immunization, something like that. But where I'm headed to, you want to say something to that?
Yeah, it's to prevent the conversion of a to an active infection from somebody that's exposed with HIV. So if you don't have HIV, you're exposed to somebody that has HIV. Some of that virus may enter your blood, maybe 10 copies or 1,000 copies. You're trying to keep that from becoming a colony of 1 million copies, which would now qualify you for. So it's just to keep you from actually
Oof.
getting it.
Okay.
Yeah, scary stuff. Scary.
Yeah, but somebody was speaking about HPV, and I remember that we talked about HPV, and the person was saying, I was trying to recall how you had said it, that if the man has HPV and there's unprotected sex, right, the woman gets it because we are more susceptible to it. Can you quickly help me explain that?
Yeah, so the lining of the vagina is more porous. Let's say it has more microscopic holes
Okay.
than the lining of the penile shaft. And those are the two surfaces that are interacting, during intercourse. So during that, you can actually push bacteria, viruses, fungus into through the vaginal wall into the woman's bloodstream. But and this can happen all the time. Like You can be constantly exposed to HPV or even to staph, just whatever is on the skin of the person that you're intimate with can be exposed to. Your immune system normally clears these things out. So you may have 1 billion, I'm just using random numbers, but you may have 1 billion immune cells, and now 1,000 copies of the virus were introduced during sex. Most of the time, majority of the time, your immune cells overwhelm that virus because they identify it as foreign, chew it up into small pieces, and there's nothing left of it. But occasionally, especially when you're immunocompromised, meaning your immune system is down because you're stressed, your immune system is down because you have poor sleep or poor diet, then now when you get exposed to those infections, the infectious agent can multiply and sometimes win. Then you now are infected,
Okay. So I wanted to ask that question first because of my question on cervical cancer and breast cancer. So early detection obviously would help. I mean, going to the screening going to screen yourself annually would bring about early detection, which would then prevent maybe a full-blown
early detection gives you more treatment options. It gives you lower cost. It gives you better survival. It gives you less emotional burden on the family. It's all of those things and more. And yes, an annual checkup or a regular checkup will allow you to have that early detection. For example, now when I typically see somebody present with cervical cancer, it's a woman somewhere between 35 and 55 or 35 and 65 who maybe went through menses or menopause. And then 2, 3, 5 years later, she now started seeing menopausal blood again. She thinks that her menses started again. Meanwhile, it's continuous, it's been running for the last 36 days. So when you now examine, you see that the cervix that has gone from the size of a walnut has gotten to the size of a small grapefruit or a large tomato, and it's all irregular and is obviously infested with cancer. That's usually stage 3 or stage 4. Those people, over half of them will be dead in 5 years. That could have been prevented with a pap smear probably 2 years earlier. Maybe 2, 3, depending on how aggressive it was, 2, 3 years before, everything was normal. There were just some abnormal cells, maybe because she was exposed to HPV. We did a pap smear and the HPV test, the blood test. We saw that she got vaccinated, maybe she got treated, would not convert to cervical cancer. I have to remind everybody, over 95% of cervical cancer is caused by HPV virus, and that's the #1 sexually transmitted virus in the world these days. The human papillomavirus, the one that also causes genital warts, causes cervical cancer and is linked to penile cancer as well.
Interesting. And then for women with breast cancer who don't check, quite a few people don't even check the self-examination for themselves, or even going to the hospital to say, oh, let me check myself. That's also a risk, right? A risk factor.
Yes, we talked about how great early detection is. That's what you doing your self breast exam should equate to, early detection. Just like if you have a small lump or you see irregular skin or you have irregular temperature, the nipple that used to point outward now points inward, anything irregular, sooner you draw that to the attention of your doctor, the sooner treatment can be started. And most of the time, I'm a surgeon, most of those times we cut it out and you go about your way. It's when you delay that we now start having problems, have to involve chemotherapy and radiation and all of that. If you can have a surgical treatment, normally that's the way to go.
Right. This is still Women Radio 91.7 FM, and we've been speaking with Dr. Abiola Ajayi, who is the MD CEO of ROA Specialist Hospital, right here on RadioDoctor this morning. RadioDoctor is a program where doctors come on, specialized doctors basically talk about different health topics for free on live radio, and so you want to do well to call us 07000 or 09155 or toll free line 0800 Better still, you can text, WhatsApp, or send a voice note to 0703 or 08155 We've been talking about the annual female checkups every woman should stop postponing, and some of them, you have to know your height, your weight, your waist circumference. All those will help you calculate your BMI, so that you know, okay, are you healthy or are you like me? And early detection obviously would help to prevent or reduce to the barest minimum the risk that you'd be at when it comes to certain illnesses. This it also detects silent killers like blood pressure. A lot of us don't know our blood pressure number up until now. And in the country, we do have a call. Hello, good morning. Hello, good morning. Hello, good morning. We cannot hear you. If you do well to call us back on 07000 or 07000 or 0800 So let's get to let's go and do our annual thing. Let's go and do it. I know someone who doesn't feel, beg your pardon, to do annual screenings, herself and her whole family. And I'm always just like, wow, so that's so cool. And I've not felt inspired to go to my own. Okay, let's continue. What symptoms should never be ignored, even if they seem minor?
You won't believe how many times I've had a woman say, "Oh, there was some blood, but it was small, so I just didn't
Oh my gosh,
say anything
yes.
about it." Even a woman that was pregnant, she still told me that last week that, "Oh yeah, I saw blood like a week ago, but it was small, so I didn't say anything."
I don't play those games. No, no.
So, anytime you see blood outside of your body, that's a symptom that should not be ignored. Blood is meant to run in your blood vessels, unless you know that it's a menstrual period, obviously. But don't ignore bleeding after sex. Don't ignore bleeding in between periods. Don't ignore bleeding after menopause. And if you have unusually heavy or unusually painful periods, don't ignore that as well. And of course, any lump you feel in your breast, if your nipple has nipple discharge or nipple retraction or skin changes, and of course, pain. So no pain is normal. We're supposed to be pain-free as human beings walking on the earth. God didn't put us in eternal pain. So if you have pain anywhere, pelvic pain, pain above your bladder, pain when you urinate, anything like that, that's a sign. It could be a sign of something else. So bring that to the attention of your doctor too.
I when I have pregnant people around me, friends, whoever, church members, whoever you are, the first once they say, "Oh, what advice?" I'm like, don't ignore anything. I think. What's interesting is that I'm very particular. You see my health game really at 100 when it comes to pregnancy. Any other thing, 0. Or maybe when it comes to my children, any other thing, 0. Because pregnancy is not, the moment you feel like you're uncomfortable, please carry your car and go to the hospital. There's no, it will go away. When you're pregnant, I know. Even if you've been pregnant for 5 times, go. There's nothing like being a professional pregnant person. I mean, I don't even, does that make sense? Like, I'm a professional at getting pregnant and having children. No, you're not. Go to the hospital there. Like, no, those are games that I don't play. Even actually when say I saw blood, be gone. I don't play those games. And if you're a woman listening, please, if you feel, we have a call again. Hello, good morning.
I'm a woman listening. Hi, Tommy. Good morning.
Mrs. Aboli, is that you?
Good morning.
Good morning. This is the first time I'm hearing you on Radio Doctor. How are you, my queen?
Because you don't allow us call. You're always conversing with the doctor. Thank you for reading out the numbers today.
Dr. Biola is my guy. That's why. Sorry.
Thank you for the call. You're welcome.
Good morning.
Good morning.
Thank you very much. All right, I have a couple of questions. First, let me start by sharing a friend's experience she shared with me this morning. She said she was thinking she had arthritis. And then when she got to the hospital, they told her that her chest, the chest region was clogged up, that she had to be on an injection, 20,000 naira on a daily basis for almost a week before something, before everything gave way. So what's the correlation when you're saying you're feeling pains that have to do with arthritis and a clog up in your chest? I don't really get the correlation. Maybe I didn't get the explanation properly, but I would like clarification on that. Did you get my question, sir?
Yeah, did she do an X-ray, like a chest X-ray?
Hello?
Do you know that?
But he's asking if she did an X-ray.
Yeah.
Did she do an X-ray?
No, she said she did all that. She did.
Okay, that makes okay.
She thought it was an arthritis pain, only for us to discover that there was so much clogged up in her chest, kind of. That's number one. Number two. Hello?
Yeah, we can hear you, Mrs. Eboli.
So,
we can hear you.
Number two. You spoke about cervical cancer. Now, cervical cancer, if you have had a partner for 20 years, you don't cheat, he doesn't cheat, are you still at risk of cervical cancer? Because I've asked a couple of doctors and they'll be like, before you met him, you have a history, he has a history. And so I'm saying, if you faithfully stayed together for 20 years as husband and wife, are you still at risk of cervical cancer? And the third one is a question that doesn't really bother on today's topic. Can I still ask it, please?
Yes, please.
All right. My son with cerebral palsy, David, he has mouth, this blister that, happens in the corner of your mouth.
Mm-hmm.
So I brought him from school. He will be 16 in October. So I brought him from school. I've been treating that ulcer and it's not going. So I don't know. Is there anything I'm not doing? I've been giving him vitamin C, giving him riboflavin. Until now, he's still experiencing that thing. And I have to take him back to school by next week. I'm only treating him. That's why I'm worried. Will he go on his own, or am I doing the right thing, or I'm not doing the right thing, because he has to go back to school. He has cerebral palsy. Could that also be a factor because he's not healing fast? I don't really understand. Please, if you did not get my question, I'll call back. For me, I gave you 3 questions, right? I believe
you did. Yes, the first one on your friend with arthritis.
I have them. I have them. I was taking notes.
Okay. All right, Dr. Abiola, over to you.
So, I try and make a habit of not explaining what people do in other hospitals. In Nigeria, we have a way to go for standardized care, Just the explanation of the chest region being blocked up doesn't make sense. No doctor should talk like that. If you're a traffic controller or you are last mile, that would make more sense. But I believe maybe she went in for arthritis. Somebody ordered an X-ray, and she may have had some infection or consolidation or something